textbooks, dermatology, primary care. Throughout our lives, we will all interact with the healthcare system. So, what happens when that system is not designed with certain groups of people in mind? As a Black person in America, I have experienced firsthand racial disparities in healthcare. The turning point for me came during the pandemic when at a local clinic, I was asked if I had a red rash on my skin. At that point, it dawned on me that some healthcare professionals did not realize that skin rashes do not exhibit the same way on different skin pigmentations. If something so obvious could be so casually overlooked by a healthcare professional, what other elements of care, treatment, research, and education are also being ignored, and what does it mean for people of color using this healthcare system? I am Vivian Kopsinger-Birchall, and in this series, we will take a closer look at racial disparities in healthcare, speaking with medical professionals, and hearing personal stories to get a better understanding of those disparities and explore ideas and strategies for how to bridge the gaps.
In the 1860s, when slavery was abolished, so Abraham Lincoln basically worked hand in hand with a gentleman called Frederick Douglass, African-American, to be able to fight alongside gallantly. They really fought, that recruited a lot of Black people, a large Black contingent to fight alongside white populations to stop slavery, to abolish that. That was very successful then because of that enlistment of Black people to participate. They actually formed an office of colored troops in Washington to be able to get additional recruitments, so because Douglass was there, because Lincoln worked with Douglass, it was easy to then recruit because the confidence was there, the Black population was able to come along and fight. Okay, so fast forward today, we can use the same approach, which really means that you need to recruit a large contingent of Black people, to be involved in addressing health disparities. It's not only in oncology. We know that's going to happen in any other fields, where we see, a lot of disparities across different things, heart disease, whatever, HIV, AIDS, COVID-19 is a good example, latest example, right? So, but just going back to the oncology example, so basically you have to recruit a lot of Black people to be, just like was done during the American Civil War, recognizing, number one, that there's racism, systemic racism in healthcare. There's the color of medicine, like you rightly said in your article. And so being Black is bad for your health, and saying that you have to abolish that, like you abolish slave trade. To abolish or eliminate that, you need to have a large contingent of Black folk participating in that. And so you have to create a pipeline. So the recommendation essentially here is that, each institutions have to first of all recognize that big need for that. I should say that President Biden and Kamala Harris have set a very good tone, in being able to recognize that there's systemic racism and, and so looking to address that. But each institutions need to do that too. You have to recruit a lot of people, Black folk, to be participating in healthcare. We'll have to raise that number from 3%, that should be the milestone, should we go 3% to at least 13%. It has to be proportional to the population of the United States. If there are 40 million people, Blacks in the United States, 13% of the population, any institution that does not have 13% of Black people in any of those areas has not met their goal. It cannot be 3%. So, and that doesn't mean it's going to happen like just today. Remember that there's this structural racism that's already there. And so you have to create a pipeline starting from high school, from even kindergarten, like you have to start from there with that daily. So it means that you have a 10-year plan, obviously a short-term plan and a long-term plan. And so, it means that you have to reinvest into that. So this is not just a policy issue. You have to actually invest money into it, recruiting, Black doctors and oncologists and researchers, creating scholarships for supporting training and stuff like that. You can call it reparations. reparations to become very toxic in some sense. Some people really support that, but some people have used that negatively. But the reparation really here is saying, let's right this wrong that's in the system. Let's create more opportunities where we can have role models and have other Frederick Douglasses, who can fight alongside white folk to be able to abolish this. Yeah, so most of the textbooks right now are still written by whites. I mean, I have been blessed to have actually written 3 books now. And one of the books is really on bridging disparities. But if you want to go to real medical textbooks, like in radiation oncology and all of that, I think that we need to have. That's why if you recruit more Black folk into the field, right, they can then be the leaders who can write textbooks that take into account your skin color or your cultural background or all of that stuff. It really has to be there. Like you have to have, those Black professors, 13% of them in any institution, or reflect the community in which you live. You really have to have that reflection. And so, yeah, so that training it just means that you have to train more people who can then and recruit them into those positions. And obviously they're going to write textbooks that reflect, the color of their skin. Number one, you want to have, just like the question there was really, if you have a Black person write a textbook, he's going to take into account the skin color, and you will not face what you faced when you went, and they're asking you, do you have red skin or something like that? In our case, you need to have Black folk leading the clinical trial. You also have to have Black people who are leading the clinical trial. So actually we know studies show that when a patient walks into the clinic and sees that the provider is of their same skin color, the experience is much better. Right. So it's easier for me to talk to my friends and say, like when I took my COVID shot, it was easier for me to tell other people who are Black to take the COVID shot because they've seen that I've taken it and I'm okay, and I'm encouraging them to do that. So that's the same thing. That's the great thing about the clinical trial. We're going to involve, leaders, oncologists who are Black as well, as few as they are, and then also the other thing is that we're actually going to be partnering with a lot of churches. Part of the things that, the cultural, so some people actually faith-based organizations can really help. So we're going to have multiple intervention levels here, where, for just the mental health component, we've seen that it's holistic. Even when you have cancer, it's not just a physical treatment, there's a spiritual and mental component of it. And so we're going to be partnering with communities, which can also encourage participation in this. Just like for COVID, we're going to be dealing with the same kind of thing that people have been dealing with COVID. And so very excited about it. I'm looking forward to coming back sometime and sharing that with you. And I should say last thing that, just going back to that historical analogy, Abraham Lincoln and Frederick Douglass working together. Black people have a role to play in this. We have to continue to be determined and do what you are doing. Actually educating people, and also, being at the front lines. I would say, some of the work that I'm doing, I'm really excited to be a part of that in that sense. But we must collaborate with white folk, with white people and other people of other races. Collaboration is key. Just like Abraham Lincoln collaborated with Douglass to abolish slavery. If we want to abolish systemic racism, we have to work together.
Because our training is influenced by the West, we use textbooks from Europe. Yes, we're in Africa. We use textbooks from Europe and textbooks from the US. So the pictures that you see there, it's the pictures of white people, and when it comes to describing symptoms, especially when it comes to skin conditions, also it does not reflect the diversity of the society, where if we talk about a mole, and the advice would be if your mole gets darker or turns purple. And the question is, if you are dark skinned, how do you identify, purple? And what is darker of a very dark skin, So I think it's just some of those issues that have been normalized by the training, and us as trainees and also as medical professionals, finding our own way of, filling the gap, which also presents problems because if it's left to individuals, all of us will interpret symptoms differently and we look at different colors differently. So it's also a reflection on the training that we receive throughout medical education.